a body of course. Oh, you dealing with the boss.
Basically, the only way you get nutrients into your joints is through change in pressure. So if I have my elbow joint, turn, change in pressure, extend, change in pressure, right? We're gonna do the same thing for your spine. Each one of these spinal segments has a disc, okay? That disc is a shock absorber in your back, right? Once it gets worn out, it starts to pancake down and go out. That out is a disc herniation or a disc bulge or a disc protrusion. It has many names, but it's all the same thing. Okay? So what we're gonna do is we're gonna pull and release, and try to bring nutrients into that herniated disc and get that disc height restored. Very effective for anyone who has disc bulging or a disc injury. You will have to get an MRI to know that for sure. X-ray is not as helpful in diagnosing that. But this can be very sore coming off of it the first time, okay? And the reason why is because if you have a worn out shock absorber, your back muscles tend to tense up really, really tight and hold that shock absorber into place. When you get stretched by this thing for the first time in a way you've never been stretched before, you're often very sore. So actually what I want to look for is the patient coming off sore the first time, but then we have them move around and shake around and twist and bend for about 30 minutes after. And if they're feeling much, much better after that, then we know the muscles have loosened up and they'll do really well with decompression. I usually have them do it twice. The second time they do it, they should feel much, much less sore coming off the table, especially if we use the same weight. Or if the patient goes home and they can lay down for the first time in like 3 years, that's usually a good sign that decompression is the right thing. If the decompression makes you so sore that you can't even get off the table, it's not the right thing for you. And there may be some underlying problem going on there, either like a pars fracture or some kind of fracture or instability that the decompression won't address very well. I have found that there's not a huge advantage to going very heavy. A lot of people want to go really, really strong. I do have a few patients who have done that. They are very experienced decompression people. They have been acclimated to it, and we've slowly, incrementally worked their way up with the weight. I would start people off at 40 pounds over 20, but I would not get caught up with the amount of weight. We just kind of start you at a comfortable level and slowly work our way up. There's not a huge advantage to going heavier. We really just want that stretch and release, and that's what does the work. Just to finish off, we do this for the low back. We can also flip it around and do it for the cervical spine, so that's the neck. And then we also have another machine that does knee decompression as well.